Okay, in this project, we worked on the Common European Framework in Medical Education at Maastricht University for improving the language proficiency and professional skills of our medical students. Hi, I'm Maryam Asoodar and I work at Maastricht University. I'm an assistant professor here in the education department at Faculty of Health, Medicine and Life Sciences. I work mostly at the task force of instructional design and e-learning, where we basically team up with teachers to integrate technology into their classrooms. For this project, I was not alone and I worked with Fatemah. So Fatemah, can you also introduce yourself?
Thank you, Maryam. Hello, I'm Fatemah and I'm also a PhD student in Maastricht University and I'm collaborating for this project.
Thank you. Now to give you a little bit of a background on how we use the Common European Framework at Maastricht University. We have an international track medicine, which means students from all over the world can register at our university to study medicine. And for the first 3 years, they can study in English. But because the language of the country is Dutch, everybody has to learn Dutch to be able to work at the hospital as well. So the way we have now organized language learning at Maastricht University is that students in the first year learn their Dutch at A1 and A2 level. Then during their second year, they learn B1 and B2 level. And then when they have the B2 level, they can register for medical Dutch during their third year of medicine. And during this course in medical Dutch, we try to replicate the situations of the hospital for the students, so they would learn in an authentic environment. The tasks that the students would have to do are mostly tasks that students would encounter at the hospital. For example, having consultations with patients. And so specifically for this course, we invite simulated patients who have been trained to play patient roles, and our students would play the doctor roles, and they have to hold a whole consultation in their second language to practice their language skills, their speaking, their consultations in a second language. At Maastricht University, we follow the CanMed model. And here, specifically in this course, we focus on professional skills, communicator, and collaborator. Going more into the details of this specific study, we focused on the perceived value of peer feedback. In this context, students received feedback from teachers, from simulated patients, and from their peers on their performance in their consultation as a doctor. The research questions we focused on were to see to what extent peer feedback influences language proficiency and communication skills for medical students. What are the students' attitudes and perceptions towards using peer feedback in medical discourse, and what are the actual issues and barriers associated with these peer feedback in the medical Dutch course. Now I give the floor to Fatemah, my colleague, to explain this study for you.
Thank you, Maryam. As Maryam mentioned, in this study, we aim to investigate how peer feedback influence on students' development of professional behavior and language proficiency, and how they perceive this process of giving and receiving feedback with their peers. Our participants are all 14th third year international track of medicine of students in Maastricht University in June 2021. Who registered in an online medical Dutch course, and they completed a brief survey about the peer feedback process. This survey included 11 items, which derived from a previous research, Cruz et al. 2015, and implemented with a focus on professional skills, perceived value, relevance to target skill developments, and potential barriers and incentive about peer feedback. Finally, to build on the themes identified from the survey, semi-structured individual interviews conducted to explore students' perceptions that are affected giving and receiving peer feedback and getting more insight into perceived barriers and incentives. Next slide, please. For the results, as you can see, in this slide, you can see the results of the survey in this table, and students agreed that peer feedback provide useful information and also unique perspectives on their performance in general, and specifically in comparison with teacher feedback and simulated patient feedback. The students also agreed that it's valuable for language proficiency and for medical professional skills. And all of the students believe that peer feedback is a kind of unique way to practice interpersonal and communication skills. It's also benefited their training, and they would change their behavior based on their peer comments. And some students thought that they need some instructions to perform it effectively, and briefer feedback and credited towards their annual evaluation would encourage them to providing feedback for their peers. And some common barriers like time limitation and fear of providing disadvantage and unhelpful feedback they mentioned. Here you can see the results of the interviews to have more insight into how students perceive peer feedback. We did individual interviews and coded the interviews based on the inductive approach and retrieved the 4 main themes regarding the peer feedback process. Based on the results, students valued the nature of peer feedback and found it uniquely informative to their training. They identified several factors of peer feedback that could make it meaningful and more valuable, such as verbal feedback, clearly defined goals and content specific, time, native body, post-discussion group, and role of the teacher and facilitator. Another main theme is emotional components and potential barriers that the student experienced during the peer feedback process. And it's included like trustworthiness, negative feeling, especially for providing feedback instead of receiving, because some students thought that it could be affected their relationship, and also lack of their knowledge in second language makes some students unconfident to providing feedback for peers. One strategy for minimizing this emotional discomfort associated with peer feedback could be the creation of anonymous feedback. However, some students acknowledge that complete anonymity is not always possible because they know each other, and in this way they will lose the advantage of verbal feedback. Students also agreed that peer feedback is helpful and valuable for language proficiency and professional skills, especially for interpersonal and communication skills, and it can help them to enhance teamwork and encourage a higher level of professional interactions among peers, and it would helpful for their future career. The last factor is also role of the education for constructive feedback, and it's related to having the structure for peer feedback. Students suggest that the receiving advanced instruction would enhance their confidence and skill in delivering peer feedback, which is consistent with the finding from other studies. For conclusion, our study provide valuable information about the peer feedback, and the students believe that it's valuable for medical professional skills training, especially for interpersonal and communication skills. Peer feedback is also informative for language proficiency. However, clearly defined goals and instruction like rubric, presence of native bodies, teacher or facilitator are essential factors in this regard. Thank you for your attention. If you have more questions, you can contact us.